Oral sex is a sexual activity that involves the use of the mouth, lips, or tongue to stimulate the genitals or anus of a partner. Like any sexual activity, oral sex carries some risks. 1. Oral cancer, HPV, which can be transmitted through oral sex, is a leading cause of oral cancer. 2. Bacterial vaginosis. Bacterial vaginosis is an infection caused by an overgrowth of bacteria in the vagina. It can be transmitted through oral sex if a partner's mouth comes into contact with the infected area. 3. Yeast infections. Yeast infections, which are caused by an overgrowth of Candida fungus, can also be transmitted through oral sex if a partner's mouth comes into contact with the infected area. 4. Allergic reactions. Some people may experience allergic reactions to certain products used during oral sex, such as lubricants or spermicides. 5. Tooth and gum damage. Oral sex can put pressure on the teeth and gums and cause damage. 6. Fatigue. Oral sex can also be tiring, and it can lead to fatigue, particularly if it is prolonged. 7. STIs. Oral sex can transmit sexually transmitted infections, STIs, such as herpes, syphilis, gonorrhea, chlamydia, and human papillomavirus, HPV. It's important to use a barrier method, such as a dental dam, to reduce the risk of transmission. 8. HIV. Although the risk of contracting HIV through oral sex is considered to be low, it is still possible to contract the virus if an infected person's blood, semen, vaginal fluids, or breast milk comes into contact with the mucous membranes of the mouth, nose, or eyes. 9. Throat infections. Oral sex can also lead to throat infections, particularly if the partner has a throat infection or is infected with an STI. It's important to practice safe sex by using barrier methods and getting tested for STIs regularly. It's also important to talk openly with your partner about their sexual health and to be aware of any symptoms that may indicate an infection. It's also worth mentioning that oral sex also carries some psychological and emotional risks, such as emotional distress, guilt, or shame. It's important to make sure that any sexual activity is consensual, and that both partners are comfortable and happy. It's always best to consult with a qualified healthcare professional if you have any concerns about your sexual health.